You wanted the best. You've got the best podcast, the hottest podcast in the world. The Chris Voss Show, the preeminent podcast with guests so smart you may experience serious brain bleed. The CEOs, authors, thought leaders, visionaries, and motivators. Get ready. Strap yourself in. Keep your hands, arms, and legs inside the vehicle at all times, because you're about to go on a monster education roller coaster with your brain. Now, here's your host, Chris Voss.
Hi, folks. It's Voss here from thechrisvossshow.com, thechrisvossshow.com. Welcome to Chris Voss Show. I don't know why anybody claps my horrible impression of an opera, an operatist. I don't know what the hell the language is. An operatist. I just made that up. So there you go. New words you learn on the Chris Voss Show. This is why you tune in, of course. But as always, we have the most amazing guests, the Chris Voss Show family. The family loves you, but doesn't judge you, at least not as harshly as your mother-in-law. And we have an amazing guest on the show we're going to be talking to today. He's going to talk about how to deal with depression and other different health ailments through different medical procedures and some of his learned things in some of his books that he's put out, et cetera, et cetera. But in the meantime, as we tease that out to you, that, of course, is set up for the shaming of the guilting of the plugs. Please refer the show to your family and friends. Have you seen them lately? They need the show. Like when you really look deep into their eyes and their soul and you think, you know, you'd be a whole lot smarter if you listen to the Chris Voss Show like I do. And so tell them. Go to iTunes.com/Chris Voss. Give us a 5-star review over there. Go to Goodreads.com/Chris Voss. LinkedIn.com/Chris Voss. YouTube.com/Chris Voss. Did I say that? And TikTok at Chris Voss1. And then when you sit around them with the holiday tables coming up with the Thanksgiving and Christmas, you'll be able to talk about, you won't be talking about politics and all that ugly stuff that makes people angry and fight at those family reunions. You'll be able to talk about, hey, did you see that really cool and interesting person as the Chris Voss Show? Yeah, I did. And then you'll just have a wonderful holiday. That's guaranteed. Wait, the lawyer's yelling at me from the corner. I can't say that. Anyway, guys, thanks for coming by the show. We have an amazing gentleman on the show. He's the author of several books. His latest book is Stick It to Depression. Get back your life naturally. It came out April 13th, 2021. Dr. Alexander Joannou is on the show with us today, and he's going to be talking to us about his latest book and everything that went into it, and he's going to imparting us some of his knowledge. He is the founder of Transformational Acupuncture, and he's learned in all things acupuncture and some of the medical aspects of it. He's a conjoint lecturer with UNSW and RACGP accredited supervisor. He's been training medical students, international medical graduates, and general practice registrars for more than 20 years to help people achieve that true feeling of peace that comes with healing. I like healing. Healing is always good. I don't like the pain of injury, so I'm into healing. I'm into that. That's my new hobby, healing. I'm 55. There's a lot of damage that needs healing. And along with that, he's learned about the human psyche in his 40-year medical career as the practice principal of Northside Health at 12 Doctor Medical Center. And his practice has led him to additional training in nutritional and environmental medicine, counseling, and cognitive behavior therapy. Sounds like something I need. And together with over 300,000 patient consultations, including performing over 35,000 acupuncture treatments, he's witnessed firsthand the complex interrelationship between the mind, the body, and spirit. Welcome to the show, Doctor. How are you?
Very well, thanks, Chris.
There you go, all the way from Australia. Is that correct, sir?
Yeah, just outside of Sydney, a place called Coffs Harbour.
There you go, as they like to say, the Down Under. Where does the Down Under come from? Why do they call it the Down Under? What's that about?
Well, you only have to look at the globe of the world, I guess.
I mean, isn't that kind of rude? Isn't it kind of rude that we always assume that North America is up here and Australia is down here? Maybe it's the other way. Maybe if you flip it the other way, I mean, you guys do have
your own on top of the world then.
Exactly. And that may explain, I don't know, your Tim Tams that you guys have over there. Anyway, give us your .com so people can find you on the interwebs, please, sir.
at stickittodepression.com.
There you go. It's
Yeah.
very easy to remember. Stick it to stick it to depression. I wanted to say stick it to the depression, but stick it to depression.com. And what motivated you want to write this book? Give us a 30,000 overview of the book and what you do.
Yeah, well, it's a long story, but I've been a GP, family physician, for 40 years now. And it all started because, I was trained at Sydney University and I thought I understood how the body works and so forth, because I'd, excelled in my studies there. And that cruised along until after about 15 years, I developed Crohn's disease.
Oh, wow.
Which is, for those who don't know, it's quite a nasty disease of the bowel, the small intestine. And within a week of diagnosis, I had to have 2 feet of intestine cut out. I had 2 4-inch abscesses in my abdomen.
Oh, wow.
So I'd lost about 20 kilos in the process, and I wasn't feeling so well. But
Definitely.
I asked the surgeon after, just before discharge from hospital, what diet should I follow? And he said, eat anything you like, you're cured. So I thought, you beauty. The trouble was, within 6 weeks of the operation, I started getting symptoms of the Crohn's disease again.
Oh, no.
Yeah, so that really spurred me into looking at alternative therapies, which was a journey through looking at, mega doses of vitamins and various herbs, and ultimately to acupuncture.
Was the alternative them taking out more of the bowel?
Yes, I was threatened about a year later with further surgery.
Oh, wow.
But when I got onto, at that stage, shiatsu therapy, which is acupressure, I suppose you'd call it, treatment, within the first session of 1 hour, my symptoms disappeared.
There you go.
Which blew my mind.
Wow. And that was under acupressure. And then you discovered, and you moved to acupuncture.
Yes.
There you go.
And so that was back in about 96. And so I've come a long way since then. Basically, I've been well ever since.
That is, wow. That is awesome. That is, and have you found that you've been able to help other people that have similar sort of traits?
Absolutely.
Wow.
Yeah.
That's crazy.
And so I'm not on any medication for it anymore. I haven't been on any medication for over 20 years.
20 years for acupuncture. Wow. So would you say that most of your patients are, walking around you on pins and needles? Sorry, I had to do that joke.
Yes.
I couldn't resist. So talk to me about this book and what's inside of it, and kind of give us a spin on it. You have 2 books, and my understanding is one book, Stick It to Depression, Another Tool in Your Doctor's Bag, was targeted towards people in the medical field.
Yeah, to help them understand how acupuncture can help their patients.
There you go. And then this one was kind of more, this newer one was kind of more for the general public?
Yes, yeah. It's I've been told it's quite readable, and basically relate this sort of stuff about how I came across acupuncture as a help. And I first learned acupuncture in about 1998, and but it was around in 2010 when I came across a method of acupuncture that helps the mental state. And I realized that ultimately was where the real power lies, because, it's easy to try and paper over problems by making you feel better in terms of symptoms of whatever problem you've got. But the deeper level of healing, which you spoke about, comes at a much deeper level of mind, body, and spirit. And I found that this acupuncture was doing it. Initially, first particular case, I'd been telling my wife for some time that, who's also a medical doctor in the practice, that a lot of the patients I were treating for whatever medical problem they had said that they felt a whole lot better, and that they weren't having arguments at home, and problems at work wasn't getting to them. So my wife kept telling me I should look into this and sort out what's going on to prove that it works. And I thought, oh, I don't need to prove it works. I know it works. But like most guys, I ignored my wife's advice. But then I had one particular patient who was seeing me. She was in her early 60s for osteoarthritis. And her arthritis had got bad enough that another doctor in the practice had put her on opioids, OxyContin type stuff.
Oh yeah.
And she didn't want to be on that because that's, as you know, can be quite addictive, and it tends to dull the mind and so on. Within 3 weeks of starting the acupuncture on her, she was able to get off those, and that was really good. Wow. But I kept going to see how long we could, how good we could really get her feeling. And after she had been having acupuncture for about a month or two, she asked if she could stop her antidepressants. And apparently she'd been taking antidepressants for 16 years.
Holy crap.
Yes. And I thought, well, maybe, okay, I assessed her from the medical viewpoint and demonstrated with the DAS, which is a depression, anxiety, stress score, that she wasn't actually depressed at the time. So gradually withdrew her antidepressants, and she was fine. And not only fine, she actually said that she felt a sense of joy and happiness. And it was particularly typified by one incident, which was it was just approaching Christmas, and some Christmas carolers came to her door and started singing Christmas carols, and she burst into tears, but it was tears of joy and happiness because she could really feel the joy in her heart. And she said she hadn't felt that for so many years, that she had been a sort of like a numb state.
Wow.
And
so you find it helps depression a lot. The book you target towards depression.
Yeah. So that was where I thought, okay, this is meeting a real need, because antidepressants, though it can help severe depression, there's still no evidence that it really helps mild to moderate depression, which is what the vast majority of people have.
Wow.
And because it's working basically by tending to numb the emotions, which is really good if you're severely depressed, it tends to decrease that depressed feeling. But on the other hand, it tends to inhibit laughter and joy and just exuberance.
There you go. So does it take a lot of sessions to break through with that? You said you with your Crohn's issue,
no.
It's fairly quick.
Yeah, that's right. I mean, usually within 8 weeks, just treating once a week, most people feel better, and some people feel extremely good in that time.
There you go.
It's usually by the end of the 8 weeks, you know if it's going to work for you or not. And it doesn't matter, as I say, whether you've been on antidepressants for years or whether you haven't been on any antidepressants. It still seems to work.
There you go. So, I mean, acupuncture has probably been around for eons of time, hasn't it? My understanding?
Yeah, about 2,000 or 3,000 years.
It's kind of probably, one of those things that must work. It's been around forever. It's kind of like Stoicism or old wisdom,
Yes.
Yeah. I mean, I used to deal with depression with vodka, but that didn't seem to make anything better.
Yes, well, that has problems in itself.
That's been around for eons of time as well, I think. I don't know.
Yeah. The side effects of that are much worse.
That's very true. I totally agree with you. So, and so you delve into this medicinal art, and it's some people's perception is that feels or looks like it hurts. Like I'm one of those.
Yeah, I understand that.
I'm one of those people who's not into needles.
Yes, it's amazing because a lot of people that I see, because I'm a doctor, I see people who wouldn't normally go to an acupuncturist, and I sort of have a discussion with them and talk them into trying it, and I say, well, let me just put one needle in and see how you go, and as soon as I put it in, they say, oh, is that all there is to it?
Yeah.
So that's a big surprise for people because it looks far worse than it feels.
There you go.
A lot of people fall asleep during a treatment. Even.
There you go. Sounds like my prom night. There you go. I'm not sure what that means. And depression, you found this really works well in healing people and getting people engaged in overcoming it. Why do you think it's this is better. This is going to seem obvious, but I want to hear your words on this.
Mm.
Why is it better for acupuncture to be used over, say, Western medicine, where we just throw
Yeah.
drugs at
Well,
everything?
of course, it can be used together, but
Mm-hmm.
the big advantage of acupuncture is it helps shift blocked emotions.
Mm-hmm.
People seem to store emotions in their body,
Oh, really?
and under Chinese theory, it's quite acceptable that various organs are associated with various emotions,
Mm-hmm.
and like sadness and grief is stored in the lungs,
Oh.
and anger and frustration is stored in the liver. And if you work on those points, you can release those emotions. Which the thing is, what we tend to do in the West is suppress our emotions. We don't want to express things because we're told it's naughty to do that. And as a kids, it's like starts back in childhood where you're taught to suppress your emotions.
There you go.
And,
so is that part of the chakras? And I was just going to say too, I used to store when my vodka drinking was going on, there was a lot of anger stored in my liver. But is that where the chakras are, which you were talking about there?
Yeah, well, that's because the chakra system is developed by the Hindus, which is in India, and in parallel with the Chinese system in China. And there didn't seem to be any real communication between the two systems of medicine over the 3,000 years. And back in 1997, an acupuncturist recognized that the certain acupuncture points actually correspond to various chakras. Oh. And therefore, you can manipulate chakra energy through acupuncture.
Mm-hmm.
And
so you do two lanes. You've got the book that tries to help the general public be aware of acupuncturists and stuff. What can the general public interact with different variations on your website and offerings there?
Yes, if they click on the Start Here button, and they can communicate directly with me.
There you go. And then you also have a thing for practitioners to be able to adapt and learn this sort of area.
Well, the system itself, if you're already an acupuncturist practicing acupuncture, it's quite easy to pick up this system. And I teach it I now teach it online as a weekly session. And sorry?
No, go ahead.
I was going to say I teach it as a weekly session, and by the end of, even the first night session, they can go out and treat somebody starting straight away. So
can you treat yourself with acupuncture?
That's a bit tricky.
And you can't probably get to your back.
I have been known to, when I played on the soccer field, to pull out some needles to needle my knee or something. But
there you go. There you go. I know the older you get, the more you have different pains and different things. And it's interesting how the body works. Years ago, decades ago, I used to have to go to massage every weekend because I was running a lot of companies and there was a lot of stress, and I had to go have a 2-hour massage. And if I didn't get that 2-hour massage and, they would explain the chakras to me, they'd be like, you're going to be a bear for the rest of the week and be ornery and miserable and stressed out. Which is pretty much my current condition at all times. So this is pretty interesting. What do you find most people? What are some misnomers or myths that people have about needles, other than the fact that there's needles involved?
Yeah, that is a big factor for a lot of people. But as I say, just try it. And one needle, and you'll be convinced it's nothing like you're expecting. The needle itself actually is blunt on the end; it's rounded, so and fine as a human hair. So when you insert the needle, it tends to push blood vessels and nerves to one side or the other, which is why you can leave the needle in for 40 minutes, take it out, and there's no bleeding.
So it's not like we're stabbing people to death and they're just going to...
No. Whereas, like if you have a blood test, for example, or a vaccine, then the needle has a beveled edge. It's sort of beveled, sharp, so it cuts through the tissue.
There you go.
This doesn't.
And so you counsel these practitioners on how to do it or how to do it better. Now, is there a specialized method that you do that's different than what maybe other people do in the field?
Yeah. Well, as I say, it is based on chakra energy, and I've developed a questionnaire to assess which chakras the person has issues with.
Okay.
And from that, I use various combinations of needles in the form of a pattern, in the form of sacred geometry to trigger the chakra into shifting.
There you go. And so people can add this to their current lineup of maybe health resources. Do you find that a lot of people that come to you are people working in the holistic area of
Yes.
medical stuff?
Yeah. I've helped a lot of massage therapists and other medical doctors as well. The medical students that come to my practice usually get offered a session to experience it for themselves.
There you go. And so are you doing a lot of online teaching where you're, it's like we're in this COVID world where everything is done on Zoom and all that sort of good stuff?
Yes, yeah. If you go to my website, there's the details there. Just follow
There you
the
go.
links.
There you go. Do you do any localized thing where people fly out to you there in Australia and
Yeah,
do?
well, I'm in Coffs Harbour, but on our website, I'm developing a list of practitioners who've studied under me.
There you
So
go.
it's a list of certified practitioners. So hopefully we'll get somebody in your area soon.
There you go. I need as much acupuncture as I possibly can. I need that, or here around the house, we don't have acupuncture as close by. So I just use a hammer to hit myself in the head. That seems to be working for a while. I don't know. I can't feel my legs.
I was going to say, make you forget about everything else.
That's true. That's my psychiatrist is recommending the frontal lobotomy. So I think that's what we're doing next week. So when people see me smiling on the show and drooling down the side of my mouth, well, it'd be like the last 15 years of the show. So there you go. What are when you help people with depression, and do you find there's any certain thing that you help people with, like any certain target of depression that helps the most, or does it help all the different spectrums of variations of depression? I know there's ADHD and there's a bunch of spectrums of that. Yeah.
It's more in the mild to moderate range. I mean, I have treated some patients with severe depression and who have improved quite dramatically, but it does take a lot longer. So it takes some sort of commitment. But also it helps people with PTSD I've helped.
Really?
Yeah. And,
wow.
And various phobias,
like
claustrophobia or agoraphobia, that sort of thing.
Now, if I have a phobia against needles, because I actually have this phobia, it probably helps fix that phobia for me?
Well, it will once you have the needle and think, oh,
there you go.
Nothing.
Well, that's what the nurse keeps telling me every time I get the vaccine, but I don't know. But no, I'm one of those
it's much less. Much less pain than
because you're just not jamming it all in there like they do at the doctor's office. That's you're just giving a little pinprick. So there you go. But that's interesting. PTSD. We've had a lot of people on the show who suffered PTSD. A lot of folks in the military. I think there's talk among psychologists that people experience PTSD with trauma.
Yes.
Childhood trauma or trauma. That happens in their life that can really shock the brain and stuff. And so you find that will help release that and deal with that, huh?
Yeah.
And is it really so it's really based on that science of we store a lot of pain in the body and a lot of our mental pain maybe in the body.
Yes. Yeah, absolutely.
There you go. There you go. And well, this is amazing. I mean, especially where you had Crohn's disease and you got over it. Any other diseases that you found that you've helped overcome or maybe improve the condition of the patient?
Asthma and hay fever.
Really? Asthma too?
Yeah.
Wow.
Yeah.
Holy crap. My mom suffers from really bad asthma.
Right.
That would be ideal. I know some people that have asthma, they usually have some trauma with their childhood and stuff. We always, they say that sometimes people with asthma, they have overbearing parents that are just really micromanagers, overbearing, put a lot of fear into the child. And so the child ends up with a lot of anxiety that turns into asthma. At least that's some theories that I've heard. I remember growing up with one of our Boy Scouts that was in my troop had really bad asthma, and he but he had the sort of parents that would never let him out of the house, that they barely let him come out to the Boy Scouts with
mm,
us, and they controlled like everything he did and how he did it, and he was terrorized to do just about anything. And we're like,
mm,
and then when he told us he had asthma, we're like, yeah, you probably have high anxiety. Somehow we knew that at the time. I don't know. We were
mm,
just kind of aware of it, even though it was the 70s.
yeah.
And so, that kind of makes sense. People
Mm,
store anxieties maybe in the
mm.
body too, along with
Yeah.
pain.
Well, it's all
Yeah.
to do with, well, a large part of it's to do with the autonomic nervous system, the sympathetic
Ah.
and the parasympathetic systems.
Mm-hmm.
And if you're constantly in a state of fear or fight or flight type thing, the sympathetic nerves are firing in
Mm-hmm.
excess. And it's the parasympathetic nervous system which enables you to relax and to nourish and build up. Whereas the sympathetic nervous system is all about preparing you to run away or fight.
Mm-hmm.
Um, Literally within 3 seconds of a scare, like if some guys came out with clubs threatening to hit you, within 3 seconds, your liver releases clotting factors to help your blood clot quicker.
Oh
So that
wow.
if you cut or bleed,
Mm-hmm.
the bleeding stops quicker. I
Mm-hmm.
mean that, and your blood pressure jumps up because it's pumping extra blood to the muscles, carrying oxygen and nutrients to the muscles to help you run or fight. And it tends to shut down the signals to the stomach and intestines, so they tend to switch off, and to the reproductive system, so that switches off, because that's the last thing you want to be thinking about when you're confronted by an angry mob.
Yeah.
Uh,
You don't want to be sitting there going, I wonder if I should do something about this angry mob or this crazy guy coming at me with a
yeah,
knife.
yeah, you just got
Yeah.
to act,
Yeah.
and that's what it's designed for.
Mm-hmm.
And as soon as the emergency is over, the sympathetic nerves switch off. But the
Mm-hmm.
thing is, nowadays, you get stuck in a traffic jam and you're tooting the horn. I went to New York recently, and I couldn't believe how much all the time people are blowing their horns, and nobody's moving, but they're all tooting away on their horns, and that just raises everybody's blood pressure and gets the sympathetic nerves going, and you think you're going to be late for work, or you haven't finished or met your targets or whatever. And so if your blood pressure's constantly elevated and your clotting factors are constantly being released, then you're more likely to get a stroke or a heart attack, for example.
There you go. That makes sense because
Mm,
we saw that with the COVID crisis and the fact that there was so much inflammation in the body where the body was
mm,
trying to fight off the virus, and since it
yes,
hadn't a blueprint yet on how to deal with this new virus, it was over inflaming the body, and by over inflaming, it was
yes.
damaging organs
Mm,
because there's a certain point where it's a response by our body to defend itself.
yeah.
It can go overboard. I mean, we see that with ADHD, where you've got too much things going on in your brain. It overloads the brain.
Yes.
um I was just recently reading David Goggins' second book. The name escapes me. I think it's never something. But he was talking about how a point where he got pulmonary and edema,
Right.
and it's a condition where the fluid builds up in the lungs,
Hmm.
and it happens a lot with people like him who are Navy SEALs. In fact,
Hmm.
many die during training because of it,
Right.
because the training is so grueling, and what they do in the water, and there's a very hard, the hell week that they
Yeah.
go through to become Navy SEALs in the U.S. And there are people who will literally die in the training because of
Right.
they'll get this lung disease, this pulmonary edema. And he finds that a lot of SEALs will have the issues throughout their lifetime,
Hmm.
also issues with their knees because they're just overworking the body,
Yeah.
and it carries that stuff. So that makes sense.
Mm, mm.
Yeah, definitely.
And part of the training that I teach acupuncturists is certain points that can help switch off the sympathetic nerves and switch on the parasympathetic nerves. So most people leave their treatment feeling a lot more relaxed and calmer than
Nice.
when they walk in. So the effect can be that quick.
There you go. So any ways people can heal and everything else. So
Mm.
I guess you recommend people pick up your book and then maybe try and find a
Yeah.
local practitioner. Is there a way that
Yes.
people can look up a directory of folks that have
Well, as I
worked
say,
with
from my
you?
website, on my
Okay.
website,
Okay.
list of certified practitioners.
Okay. So you can find a local practitioner that
Mm,
has worked with your method, and
yeah.
then see if you can utilize them and all that good stuff. And then
Yes.
you'll keep adding to the website as things go. So what's the best way people can onboard with you or get to know you better, reach out to you
Yeah. Well,
and
if
talk to you?
they click on start here, I'll reply to their email.
There you go. There
I'm
you go.
quite happy to connect.
So what have we covered we should talk about we haven't touched on?
Oh, there's a million things. I guess one one thing is actually which you probably appreciate the World Health Organization's definition of health, which
Hmm.
is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. And that sounds fantastic. In a room of about 100 people, I asked who at the moment is in a state of complete physical, mental, and social well-being, and I think 4 people put up their hands. So
And they
all
were
of
long.
us, yeah. So on that, I mean, that's obviously the ideal, but
Uh-huh.
the thing is, even today, the training of doctors is to look for disease and infirmity.
Hmm.
They're not trained to help assist people get into a state of joy and happiness.
Hmm.
And so the whole of the focus, especially with depression, where there's no specific blood test or X-ray you can do that will show this person's depressed. It's based on a questionnaire,
Hmm.
and the questionnaire that's commonly used has no questions about happiness and joy. It's all negative stuff about depression.
Yeah.
So, and if you score less than 4, you're said to be not depressed. So, as far as the doctor's concerned, if you have an absence of depression, everything's fine. But the absence of depression does not equal the presence of happiness. There's a world
Uh-huh.
of difference between the two.
There you go. This is really interesting. I've got a couple friends actually that were in the military that have PTSD and they struggle with it.
Mm.
I'll have to make a recommendation to them to check it out
Yes, I
and
would.
see if it can get some support there. So I'm glad
Yeah,
you've come up with this. This is really interesting.
thanks.
I mean, it's just amazing you overcame the Crohn's disease
Yeah,
and different things, and anything that can help people. And I know that sometimes you go to the doctors and they're just like, well, let's slice and dice you up into little pieces, and I'm
mm.
sure you'll feel better then. Or
Yes,
here, take these 50 pills that will interact with you. Here in America, we're really big on that. We're like, here's a bunch of
yes,
pills, and then half of them have horrible side effects, and the other half will
yeah,
interact with each other and actually make
that's right.
things worse. And then you're gonna have to take a third pill to counteract the 2 pills you're taking that are going to
Yes,
give you
that's
side
exactly
effects.
right.
They
It's
actually,
all too common, actually.
yeah, we actually have commercials on TV. They're like, "Hey, are you taking that one pill? You notice you got side effects. Or if you take it with another pill, you notice you have side effects. We have this new pill that helps counter the side effects of that." And then
Yeah,
I don't know if you ever watched American TV, but then they read off like a half an hour list of all the potential side effects of any drug.
right.
It's like, hey, do you suffer from depression? If you take this pill, you won't have depression anymore, but you might have a colonostic bleeding, liver disease. Your kidney might just wander out of your body, and you'll probably see everything in double for the rest of your life. But
Yeah,
it will fix your depression. And you're just like,
yes. I
what?
know
What?
it's not good. It's not good. The thing is, people want a quick fix, and you know, things like depression. It's often a lifetime of learning, and you've got to unlearn bad habits or bad ways of thinking
Hmm.
to improve your life, and that takes effort.
There you
And,
go.
but at least with the acupuncture, the effect, the calming and relaxing effect can work from the very first treatment. So that helps give the person hope and
There
motivates
you
them
go.
to keep coming back.
Well, hopefully that's what we've done. We've given some listeners hope out there, and at their
Mm.
practitioners, they can reach out to you. If they're people in the just the average everyday person, they can grab your book and they can maybe seek out some local help. Anything further you want to plug before we go out?
Oh no, that's That's all. I'm just looking out particularly for any acupuncturists who are interested in learning this method. I've trained some Canadian acupuncturists, but no American acupuncturists at this point.
There you go. Maybe we need more of that. We're too much steeped in America into this whole pill popping culture, and just do surgery and I've learned a lot about holistic health. I mean, just eating better sometimes. Maybe getting off the vodka, that can help too, from what I understand. Yeah, I got off that, and my body is like, thank you very much.
Yes.
We're going to treat you better, and we like you better now that you got off that booze. And now if I can just get off the heroin and meth, I'll be fine. No, I'm just kidding, people. I've never done that. Don't do that. Don't do that. The attorney says we have to say that, even though there's jokes. So thank you very much, Doctor, for coming on the show. We really appreciate it.
Pleasure.
Give us your .com so people can find you on the interwebs.
Yes, stickittodepression.com.
There you go, folks. Let's stick it to depression once and for all. I'm for that. I suffered depression most of my life. So there you go. Thanks so much for tuning in. Go to goodreads.com/Chris Voss, youtube.com/Chris Voss, linkedin.com/Chris Voss, and Chris Voss 1 on TikTok. Thanks so much for tuning in. Be good to each other. Stay safe. We'll see you guys